Hello, I'm Dr. Maya Chakerian, and this is the third in my video series about male sexual dysfunction. I am the founder and owner of Sereno Santé, a medical practice specializing in lifestyle improvement for my patients. This includes sexual health for both men and women. In this video, I'm going to discuss one of the newest and most effective treatments for erectile dysfunction. This technology is also able to treat women's sexual health, but I will save that discussion for another video. We call this treatment at Sereno Santé Jockwave. Jockwave utilizes the Alma Duo device, which involves the application of acoustic waves aimed at the genitals and surrounding area to increase blood flow and sensation. There have been several studies with this device which led to its clearance by the FDA. The studies began with laboratory tests on tissue outside the body, which showed that new blood vessels could be formed by exposing the tissue to low-intensity shock waves. 1 week after exposure to the shock waves, the markers for blood vessel growth were shown to be significantly higher. Various animal studies confirmed that more blood vessels were seen in treated areas following exposure to shock waves compared to non-treated areas. In human studies, low-intensity shockwave therapy has been looked at for heart disease and erectile dysfunction, since both are known to be affected by reduced blood flow. Since our topic today is on erectile dysfunction, I'm going to limit my discussion to this. The first study was carried out in 2010 on 20 men with mild to moderate ED due to cardiovascular disease. These subjects had had ED for an average of 3 years and were able to function sexually with the use of PDE5 inhibitors such as Viagra or Cialis. The men received 2 shockwave treatments per week for 3 weeks, then had 3 weeks off, then the series was repeated. The results were that 15 men improved significantly in erectile function, while 5 did not. Those who responded had increases in the duration of the erections and in penile rigidity. Penile blood flow was measured and was also found to increase significantly in the treated group. At the 6-month follow-up visit, 10 of the 15 men reported that they still had spontaneous erections that did not require the use of PDE5 inhibitors. In 2012, a second study was carried out on 29 men who did not respond to PDE5 inhibitor therapy. The results were comparable to those of the first study. At the end of the study, 28% had achieved normal erections and 72% were able to achieve vaginal penetration with the use of PDE5 inhibitor therapy. Overall, 71% of these previously non-responders to PDE5 inhibitor therapy became responders. Blood flow studies showed penile blood flow to be significantly improved. In both of these studies, none of the men reported any pain with the treatment or any adverse events during or after the treatment. Because of these encouraging results, a double-blind study of 60 men with ED was performed. The men who received the sham treatment were treated with an identical probe that did not produce any shock waves, but sounded similar and felt similar. The results were that the patients who received the shockwave treatment showed significant improvement in blood flow compared to the sham treatment group. The patients in the treatment group were followed for the next 2 years and had no waning of the improvement in sexual function over that time. The Duo was first sold in the US in January 2021, and Sereno Santé has been the first in the Bay Area to offer this treatment. The treatment is quick and painless. It takes 15 minutes per session, and we recommend a minimum of 6 sessions. We're excited to be able to offer treatment to so many couples who have been affected by erectile dysfunction. If you would like to come in for a consultation, please call or visit our website. I'm Maya Chakerian. I'll see you soon at Sereno Santé.